morning, Dr. Anand Sivaraman. It's nice to have you here at Treat DM 2025. Can you please tell us what is the role of Oculomics in management of diabetes and other systemic diseases? We know that's what you're going to be speaking on at this conference.
Thanks so much, Dr. Bhavna. The way we look at the field of oculomics is biomarkers in the eye that enable us to detect both systemic diseases as well as diseases of the eye. So in that, we are looking at cardiovascular risks. So a lot of what I'm going to be talking about is early research that show promise in detecting cardiovascular risk, chronic kidney disease, as well as something as novel as maternal health in terms of preeclampsia. So these are the kind of research themes that we're going to be talking about and how this is possibly a field that will revolutionize preventive health. So that's really what the focus is with.
So, Dr. Shivraman, you're the co-founder and CEO at Remidio Innovative Solutions. What is the technology that you have been able to develop over a period of time available for clinicians to use in our daily practice today?
So one of the key innovations that we did was to ask the question, how do you make retinal imaging devices simpler and more affordable? What this means is you can complete an eye exam within the convenience of your own clinic as opposed to actually having the patient be sent to an ophthalmologist for a consult or referral. At the same time, we have AI algorithms that actually work on the device without the need for any internet connectivity. And this means that you can get actually a diagnosis as soon as you're able to screen the patient. So what this means is you can now have a comprehensive management of the patient without necessarily having to depend on an ophthalmologist to be available for screening for diabetic eye disease. So we started with diabetic eye disease, and now the idea is you can also screen for other conditions of the eye and other conditions of the body.
So what you're trying to tell us is we use the camera, the Remedio fundus and phone camera. We take an image of the retina, and we are able to get a report which can tell a patient if they have diabetic retinopathy or glaucoma and AMD. How do you see this affecting clinical practice? Where is this going to be used, this technology?
So it is going to be used in today, for example, if you have a patient that comes in and actually gets every 3 months a workup that is done either in terms of measurement of biomarkers in the blood as well as, let's say, glucose and A1C, etc. Usually once a year you need to ensure that a comprehensive eye exam is also done among these patients. So the advantage of these devices that we have built is the fact that you're able to do this within your own practice. What this means is, of course, revenues that come as a result of doing the screening within the practice. You also don't have patients that are lost to follow-up. That is a second big advantage that you have. And at the end of the day, I think it's also being able to create that stickiness with the patient where he or she then feels comfortable that whatever he needs is getting done within your practice as opposed to actually going out and then coming back and again.
Are there referral pathways referring these patients who are detected with eye disease to ophthalmologists for treatment?
So in public health centers, we do have referral pathways. So there, the point of screening and the point of treatment are usually connected. In government district hospitals or regional institutes of ophthalmology, you would actually have the treatment, whether it's laser or vitreoretinal surgery. In private practice, what we've often seen is most diabetologists and endocrinologists may actually already have a relationship with an ophthalmologist. So what ends up happening in most cases is the referral pathway automatically happens to the ophthalmologist as a result of the outcomes of the screening. Some of the interesting models that we are starting to see is where ophthalmologists then place cameras with endocrinologists and diabetologists because that now acts as a referral pathway as well. So both of these models seem to be evolving in the market.
And what are the exciting new work that has been happening in terms of cardiovascular disease prevention at Remedy?
What's been very interesting is looking at something called the retinal calcium score. So just as you have a CT calcium score that helps risk triage a patient for cardiovascular disease, so we have something called the retinal calcium score. And what's very interesting is we are able to see that with a fair level of accuracy, of course, has to be still prospectively validated, we are able to give a value for the retinal calcium score, which is very close to the CT calcium score. And This is something that we are finding in literature as well. Others have done this as well. So what this means is the same retinal image that was now used for detecting eye diseases can now also be used for risk triaging a patient for cardiovascular risk as well.
I think we have very exciting times ahead where we can look at the image of an eye and tell our patient what is going on with overall systemic health and, of course, diagnose eye disease as well. Thank you, Dr. Sivaraman, for your insights today.
Thank you so much. So the eye is the window to this whole thing.
Yes, to the soul.
It is.
To the soul. Yes. Thank you.
Thank you.